Hi, my name is Rachel Garces, and today I will be discussing barriers to healthcare and discrimination against transgender people. Did you know that 1 in 5 transgender individuals postponed or did not seek healthcare because of fear of discrimination? Besides just fear of discrimination, once trans people do seek care, they are often given less than ideal quality of care. This can occur because many providers may be transphobic, ignorant, or maybe just uncomfortable. In addition, transgender people may have an even bigger need to have quality care because of the delicacy of their medical needs. Hormone therapy and reassignment surgeries can be very important to some transgender people to allow them to feel comfortable in their own bodies. One study, based on 30 trans individuals and 11 physicians, showed that both the trans patients and their physicians realized that a lack of knowledge and awareness was a large barrier to care. One patient quoted, "Lots of doctors that are practicing now, they don't have a clue what we're talking about half the time. My doctor didn't even know what level my T, or testosterone, should be at." Some patients even noted that their physician requested they seek care through a different clinic that had more experience with transition care. Now that we've heard a little bit about what makes health disparities so prevalent in the transgender community, let's talk about some specifics. The first health disparity that acts as a barrier to health for transgender individuals is mental health. Negative stigma, prejudice, and lack of acceptance contribute to higher rates of mental illnesses among the transgender population. In the Healthy Mind study, a survey identified college students as either gender minority, meaning transgender, non-binary, or identifying with a gender that they weren't assigned to at birth, or cisgender, meaning identifying with the gender that they were assigned to at birth. In the study, nearly 80% of gender minority college students reported having at least one mental health issue, compared to 45% of their cisgender peers. In addition to the mental health disparities that occur in transgender populations, there's also a drastically higher suicide rate amongst transgender people. The National Institute of Health cohort study showed that 29% of transgender patients sampled had ever attempted suicide, compared to 8.5% of cisgender patients in Study 1 and 12.9% of cisgender patients in Study 2. More generally, 48% of transgender adults say that they have contemplated suicide in the past 12 months, compared to only 4% in the overall population in the U.S. Another more general study shows that the percent of transgender people who have attempted suicide is 41%, compared to 1.6% for the general U.S. population. In addition, violence and murder rates are also vastly higher, and overall contribute to the lower life expectancy for transgender people compared to cisgendered people. The next disparity exists with HIV infection rates. There is generally a much higher risk for HIV infection among the transgender population. Transgender women in particular have 34.2 greater odds of living with HIV compared to cisgendered adults. Not only are transgender people underserved in prevention and treatment services for HIV, but also in their access and quality to medical care once a person is infected. This disparity in treatment, care, and access can lead to lifelong consequences and can drastically influence the prognosis of somebody affected with HIV. Health insurance can also act as a barrier for many transgender individuals. Many insurers reject or deny approval to transgender patients because of their need for gender-affirming care, citing the expensive cost of hormone therapy or reassignment surgeries. It is to be noted, though, that gender-affirming care is necessary to improving the overall well-being and health of transgender people. In a 2015 survey, 13% of transgender people stated that they have no health insurance at all. So now that we know a little bit about what disparities transgender individuals face, how can we break down these barriers and lessen the gaps? Well, here's some strategies for improvement. One easy way to make transgender people feel more comfortable around healthcare settings is making gender-neutral bathrooms at all offices, hospitals, or institutions of healthcare. Next, we can implement multiple options or have a write-in option on questionnaires that ask about gender. We should also work to educate healthcare providers on trans-specific healthcare needs. Also, ask preferred pronouns and use them for all encounters. This should be normalized and is a really easy way of making a transgender person feel valid and comfortable in their own skin. Lastly, be an ally. As future healthcare professionals, it is so important to educate yourself now and be prepared to stand up for this special population. Unfortunately, prejudice will always exist and contribute to this disparity. But how can we do more to lessen the stigma against non-traditional genders and educate healthcare providers about transgender-specific needs? Do you think it is fair to deny a transgender individual from insurance because they are going to have many high-cost procedures and lifelong treatments? The following are the references that were used throughout this presentation. These are the references for the images that were used in this video.